So as we look at the skeletal system, we're going to break it up into two basic sets of bones. So we'll look first at the axial skeleton. You can think of that as like the head and the trunk, so the spine, the thorax, the face, the head. And then we'll look at the appendicular skeleton, which is shoulder, arms, pelvis, and legs. And that'll be a separate lecture and a separate set of bones that you need to learn. So if we look at the axial skeleton, we looked at this picture previously. We'll just remember that there are 80 bones in the axial skeleton. You can see there. And we'll start by taking a look at the head and face, and then we'll kind of move down into the spine and thorax. So if we look at the axial skeleton separate from the rest of the skeleton, you can see here what it looks like. We can break that down into skull. Really, we should probably call this thorax. And then spine or vertebrae. And that'll kind of take us through what we need to know for the axial skeleton. Under skull, you'll see that we have a kind of a few different categories there. You have the cranium, which is kind of the head, and then you've got the face, so you can see how that breaks down. Then there's a couple of associated bones in the head and neck. You have 3 auditory ossicles, those small bones you may have learned hammer, anvil, and stirrup when you were in high school or junior high. The malleus, the incus, and the stapes. So you have 3 of those in both ears, so that's where the 6 comes from. And then you have 1 hyoid bone, which is kind of a floating bone there in the neck that's important for swallowing. And then we'll head down to here towards the end of the lecture, so you can see there the vertebrae has 24 vertebrae, 7 cervical and 12 thoracic and 5 lumbar, and then you've got the sacrum and the coccyx. So we're going to start at the top and work our way down. The skull, as we mentioned, has 8 bones, but really there's a few pairs of bones, so you only have to really learn 6 names, and we'll go through those. That's that floating hyoid bone in the neck, and then there are those auditory ossicles I mentioned, those tiny bones, the malleus, the incus, and the stapes, and there's 2 sets of those. Okay, so let's look at the bones of the cranium, of the head, and we'll look at these 8 bones together, really just 6 bones with a couple of pairs. But your forehead, the bone in the front of your head, is called the frontal bone, so that should be easy to remember. The bone just kind of behind that, if you just take your hand from your forehead and rub it over to the top of your head, this will be the parietal bones. You have a right and a left parietal bone. So that's this bone here. So if you take your hand that's now on the top of your head and kind of bring it down to the right side, and just before you get to your ear, you're going to find this other bone here. This is the temporal bone. And of course there's 2, there's 1 on each side. And then if you just bring your hand to the back of your head, towards where the head meets the spine, you'll see there is the occipital bone on the back. So 1 frontal, 1 occipital, 2 temporal, and 2 parietal. And these are the bones that are kind of easy to see from the outside. You'll notice there's another bone here called the sphenoid bone. You have 1 of those that kind of bridges between the 2 temporal bones just underneath the frontal bone. And we'll see some pictures looking on the undersurface of the skull. We'll be able to see that sphenoid bone better. That sphenoid bone is kind of where people talk about your temple, being that kind of soft spot there, just above your cheekbone, kind of on the side of your head. That would be the sphenoid bone. And then we're just getting a tiny hint of something called the ethmoid bone in there looking through the orbit. We'll get a better picture of that ethmoid bone later when we flip the skull upside down and take a look inside. So those are your bones, the ethmoid, the sphenoid, 2 temporal, 2 parietal, 1 frontal, and 1 occipital. Taking the colors away, this is what a real skull would look like. And there are these lines you can see, even on a real skull, that kind of help you see the separation of one bone from another. And we call those lines, we call them sutures. And we'll talk about the different sutures here in a bit. But right now I just want you to try and see them. You can see there's another suture here. There's another suture back here. And so we'll take a look at these sutures specifically here in a minute. But this is just to show you the same frontal bone, parietal bone, occipital bone back here, temporal bone here, sphenoid would be here, and ethmoid would be in there. If we kind of flip the head around and look at the front of the head, you can see that frontal bone pretty much covers all of the forehead. And you can see the sphenoid there, that purple one on either side, that kind of soft area, just kind of lateral and a little bit superior to your eye. And from the frontal view, you can maybe just see the top of the parietal bones up here. And that's really about it. If we now take a look at that sphenoid and ethmoid bone, you can see the sphenoid bone goes from this end to this end, and you can see it outlined here. And so you can see it kind of acts like if you have temporal bone here and temporal bone here, the sphenoid bone kind of is like a brace that runs across and attaches to either side of the skull. And again, we'll see a picture looking on the inside. The ethmoid is this green bone here, and you can see it forms part of the back of the nose, and it's kind of behind the nose and underneath the forehead. Hard to see on this view. We'll see it better on an inside view of the skull. All right, as we start looking at the bones, and we're going to kind of flip the skull over and look on the underside, we're going to look on the inside, and what we're going to find are not just bones, and of course you'll have to learn the names of the bones, but probably what will be more challenging is starting to see and name various holes, canals, ridges, processes that come off of these different bones. And the reason I show you this picture is just so you can see the undersurface of the brain, of course, the brain is fitting inside the skull. But in order for the medulla, which becomes the spinal cord, to exit the brain, in order for all of these cranial nerves to exit the brain, you're going to have holes in the skull that allow these nerves and the spinal cord to exit. And so as we start to look on the backside of the underside of the skull, we're going to see lots of different holes and canals, and many of them help these nerves as well as other arteries that come in and out of the brain to enter and exit the skull. We'll look at these particular cranial nerves when we get into the nervous system part of the course, so you don't have to memorize these nerves now. I just wanted you to understand how they're all over the bottom of the brain, and they need to have a way of escaping the brain, and that requires a lot of the that we're going to see here on the next pictures. Okay, if we look at the back, so we looked at the side, we looked at the front. Now if we look at the back of the skull, you can see that occipital bone looks a lot bigger now than it did from that side view. Again, you can see the right and left parietal bones, you can see the right and left temporal bones. And that's about all that you can see from the posterior view. Now this is going to be important for you, especially when you're taking your exams, to make sure the first thing you want to do is say, what view am I looking at? Whether it's a bone, whether it's a skull, whether it's a muscle or an arm or a leg or the back, you want to ask yourself, what view am I looking at? Is this a anterior view? Is this a posterior view? Is this a lateral view? Is this a view of the top? And that's going to help you determine what it is that you're looking at, because you can see how different bones become more prominent depending on what view you're looking at. So here on the posterior view, what's really prominent is the occipital bone and the two parietal bones. You do get a little bit of the temporal bones as well. Let's go back here just for a minute. Let me point out something that's kind of easy to see. If you remember, I was talking about in class that part of what you're going to learn to do in anatomy is to identify kind of those easy to see, maybe easy to memorize parts of the body, whether we're talking about bones or muscle or nerves. And so you need to look for things that are kind of prominent, things that are uniquely shaped, or things that are large, or things that look different from the things around it. And those will become references for you, and then you can memorize other structures in relation to that structure. So one of those on the temporal bone is called the mastoid process. So you'll see, if we blow this up a little bit, kind of on the posterior aspect of the temporal bone, you can see this kind of projection. You see it here on the other side as well, right over here. And that projection is called the mastoid process. And that's one of the parts of the temporal bone that you're going to have to learn. I just pointed out on this view because on the posterior view, it's quite visible. Also on the lateral view, you can see it. And this is going to become important here in a minute. I'll talk about why that's an important structure to know. Something that's really unique to the temporal bone is this kind of really pointy, almost spine or spike-like projection from the posterior aspect of the temporal bone, and that's called the styloid process. And you're going to see this word styloid a few times in anatomy, and it really means like spine, or I almost think of it as like thorn-like. It's just kind of a really spiky projection of bone. We're going to find one in the ulna, there's one in the radius, in a couple different places we'll see styloid processes. So this is the styloid process of the temporal bone. Okay, and if we take away the color and look at an actual posterior view of the skull, we can see, of course, the occipital bone there, and parietal. And now we can see some sutures really close up. So this suture that separates the two parietal bones, that's called the sagittal suture, and that's one that you'll need to learn. And it just basically cuts the skull into a sagittal plane, so that should be fairly easy for you to remember. I don't know if any of you, I guess there's a lot of Greek activity on campus, and the letter lambda in Greek looks like this. So that's the Greek letter lambda. And you can see here how this array of sutures kind of looks like a lambda from Greek. And so we call that the lambdoid suture. This is the lambdoid suture, this one here, that separates the occipital bone from the two parietal bones. So you have the sagittal suture and the lambdoid suture. If we look at the top view of the skull, we can see some different bones more prominently. You get just a tiny bit of the occipital bone here. You can really see that sagittal suture now with the right and left parietal bones. And we're going to add another suture. This is called the coronal suture. And if you remember the planes that we talked about earlier in the course, this would cut the skull and the brain into a coronal view. So that's why we call it the coronal suture. So you're going to have to remember the lambdoid suture, the sagittal suture, and the coronal suture. Those are the three that I really want you to know. Okay, now it gets a bit more complicated when we turn the skull upside down and we look underneath the skull. So this would be kind of taking your skull and turning it and looking from the bottom. So this would be a bottom view or an inferior view of the skull. You can see now that occipital bone is quite big. That's the yellow. It takes up really almost half of that posterior view. You can also see the temporal bone in red and see how that kind of articulates with the occipital bone. You can see right here where it articulates. You can now begin to see more of that sphenoid bone, that purple bone, and see how it goes all the way across from the right to the left. And some of it's hidden there by ethmoid bone. But see how it's almost bat-shaped? How you've got a wing here and a wing here of a bat? We'll see a picture again here in a minute. And kind of tucked around this sphenoid bone, you're starting to see the ethmoid bone there a little bit more on the inferior surface. Now there's a couple of things that become really clear on this inferior view, and that's this huge hole in the middle. And that hole is so big because the spinal cord has to come out of the skull at that point. And it's actually the largest hole in the skull. So, and if you remember when we were talking about uh, the names of bony features, we looked at a word called foramen, which meant opening or hole. So this is going to be a foramen, but it's the absolute largest foramen in the skull, and so we give it a very Latin name meaning biggest hole, and that's foramen magnum, right? Magnum means large, means big, means great, and so this is the large or the great hole that the spinal cord comes out of. There's a couple of other smaller holes that you can notice, and I'm not going to make you learn some of these, but just so you can see, there's the carotid canal, so that's the hole that the carotid artery comes in and out of. You can see on both sides. One that you do need to learn is this external acoustic meatus, and we'll see it on other pictures, but on the inferior view you can kind of see it there. And this is the hole that sound waves will travel through in order to vibrate the tympanic membrane and cause sound to be heard. So here we go again, looking at the undersurface. And the sutures are a little bit more difficult to see, but you can see there's a separation. There's a suture there, and there's a suture here. So that's going to separate the occiput. So all of this is the occipital bone. And you're going to see temporal bone is going to be here, and temporal bone is going to be here. And then sphenoid is going to be in here. And ethmoid is going to be here in the middle. There's your foramen magnum again, the spinal cord comes out of. And there's a few other foramens here, but I'm not going to have you memorize these ones. So, now this view is telling you, is based really from a top-down view, but it's showing you if we took a cross-section through the skull. So basically we cut the top of the skull off and looked inside the skull from the top down, we can see some other bones a little bit better. And the one that we can really see well that we haven't seen before is the sphenoid bone. We finally get a view of the whole sphenoid, if you see this kind of bluish purple bone. And now you can really see how it looks like a bat with wings, right? And in fact, it doesn't just look like one bat with wings, it looks like a bat inside a bat, almost a double bat. And so when we get to the pictures of the sphenoid, you're going to see we're going to call these the greater wings, and we're going to call these the lesser wings. And something else you might notice from this picture is right in the middle of the sphenoid bone, right here, there's kind of a depression. It almost looks like a little seat that something could sit inside there. And that's because something does sit inside there. This is called the sella turcica. And right inside it is where the pituitary gland sits. And so we'll see that on another picture here in a minute. So we've still got the occipital bone, we've still got temporal bones on each side, and there's a little bit of the ethmoid bone as well. This would be just a picture from without the colors from a real skull. The main thing I want to point out on this one is notice all these little holes here. This is how you're going to identify the ethmoid bone. So the ethmoid bone is a pneumatized bone. It means it has little air pockets, little air cells inside. And you can see those when you look on the inside of the skull. You can actually see the little air cells. And so that's how you're going to identify that that's the ethmoid bone. It also has this kind of funny, almost hook-shaped projection coming off of it. And we'll see this in greater detail in a minute. But here would be occipital, here would be temporal and temporal. This would be sphenoid here, kind of coming out like that. This would be kind of cutting through a sagittal section of the skull and taking a look on the inside. This is going to help us see the ethmoid bone a bit better. So the ethmoid bone is going to go basically from here to here. You can see how, so the nose would be here, right? So you can see how it's really right behind the nose and actually forms part of the nasal septum in between the two sides of the nose. Another thing that's prominent here are the sinuses. These are usually air-filled parts in bone, but they can become filled with fluid or mucus. You can see here in the frontal bone, there's a frontal sinus. You can see here in the sphenoid bone, there's a sphenoid sinus. What else can we see? You can also see some of the sutures here separating frontal bone from parietal bone from occipital bone. And you can almost see that there's three sections, right? There's like 1, 2, and 3. And we're going to look at that here, those three sections here in a minute. Okay, so let's just look at each bone in particular and start looking at unique aspects of each of these bones. If we take the occipital bone out, for example, we can see just a few prominent features that I want you to learn. So in addition to learning the bone as a whole, I want you to learn a few of the markings on that bone. So the foramen magnum here, this big hole in the middle, we've already talked about. So make sure you learn that. And then there are also these very prominent projections here, which are called occipital condyles. Now that's where the first cervical vertebrae is going to attach the skull to the spine. So that's a very important projection or marking on the occipital bone that you should learn. So make sure you know the foramen magnum and the two occipital condyles, which articulate with the cervical vertebrae. The rest of these we're not really going to make you learn, but I'll just tell you that these nuchal lines, for example, these are where some of the muscles and ligaments are attaching from the neck to the skull that help you move your head up and down and side to side. If we take out the temporal bone and look at it separately, there are a few parts here of the temporal bone that I want you to learn. First is this kind of big or flat part here. It's called the squamous part. If you remember, we were talking about squamous epithelial cells, and we said that they were the flattened, they kind of looked like that. They were kind of flattened or squished cells. Well, this part of the bone is very thin, very flat, and so it's called the squamous part of the bone. It's kind of the thinnest part of the temporal bone and therefore kind of the most susceptible to injury. Some other things that we've seen before, but I just want to point out here is the external acoustic meatus. That's where sound is going to travel and hit the tympanic membrane. If we blow this up a little bit, we can see a couple of other things that we've already looked at before. We can see the mastoid process, this kind of rounded projection coming off the posterior side of the temporal bone. Notice it's just posterior to the ear, and this is going to become important for ear infections, and I'll show you kind of a cutaway picture here in a minute. You can see again the styloid process from the side. See this kind of spike that looks like it's coming down. Again, that spike should be an easy to identify anatomical marking so that you'll know, okay, that spike is the styloid process, and that's kind of inferior to the external acoustic meatus, and this is the temporal bone. Something else that's important, you see this bone kind of coming off of the temporal bone. We call that the zygomatic process. That's going to be important when we get to the face because your cheekbone is formed by the zygomatic bone, and the zygomatic process here kind of connects to that zygomatic bone to form your cheekbone in the face. So you do have to learn zygomatic process. So make sure you know the squamous part, the external acoustic meatus, the mastoid process, the styloid process, and the zygomatic process. Now if we look at this cutaway picture, I want just to show you the mastoid and why it's important. So here is the external acoustic meatus, right? This is where your eardrum will be just inside of this hole. And so when you get a middle ear infection, you can get fluid and even pus behind that eardrum. And if it's not treated properly or quickly enough, that infection can go from this area of the middle ear. You see there's only really a thin bone here separating that middle ear from the mastoid process. So the infection can actually travel back into the mastoid air cells and begin to fill up pus in all of these air cells. So the mastoid process is another one of those pneumatized bones. And you can get an infection back here in the bone, which we call mastoiditis. So it's just got that term mastoid, and then itis just means inflammation. So mastoiditis can be a complication of an ear infection, and it's something that we look for clinically. So knowing where that part of the bone is, if you'll just put your finger behind your right ear and just slide it kind of backwards and a little bit inferior, you'll find a bump right behind your ear. That's the mastoid process. And in people who have mastoiditis, that area gets red, inflamed, becomes tender when you touch on it, and that becomes a more serious infection that needs to be treated usually with IV antibiotics. Okay, if we kind of look at the temporal bone from other angles, there isn't really anything new here for you to learn, but you can see the styloid process in all of its spiky glory there. You can see the zygomatic process that we mentioned before. If you look on the inside, you can see the internal acoustic meatus. That is one that you'll need to learn. So the external acoustic meatus obviously goes through and comes out the internal acoustic meatus. And that's where the nerve that codes for hearing is going to exit the ear and enter the brain. So make sure you do know the internal acoustic meatus. So we talked about the squamous part. Remember, that's kind of the thin, flat part of the temporal bone. But there's a thick part that basically surrounds the hearing and balance apparatus inside the ear to kind of protect that. It's a very thick part. It's difficult to break, and so that produces great protection for those very sensitive hearing and balance organs inside the ear. And we call that the petrous part. So petrous equals rock. It's where the name Peter comes from. Peter means rock. If any of you are named Peter or have a family member named Peter, it means rock, solid, firm. And so that's the petrous part of the bone. So make sure you know squamous part, petrous part. Make sure you know external acoustic meatus and internal acoustic meatus. And I apologize here. This bat picture seems to have covered over the sphenoid bone. If you look on the PowerPoint that I've uploaded, you'll be able to kind of see this picture without the Batman symbol. But I did want you to associate the sphenoid bone with a bat, because you're going to get greater and lesser wings. So you can see there's a greater wing here as the outside part of the sphenoid bone, kind of out here. A couple of other things you'll need to learn. We really need to look at that posterior view. There's a few things you need to know here. You need to know the optic canal, the optic groove. You need to know the greater wings and the lesser wings. And you need to know the sella turcica, which is going to be over here. So we'll look at that together in lab just to make sure that you got those pieces. But like I said, on the PowerPoint, you should be able to see the actual picture and to identify all of those parts. But make sure you know the ones here. This is sella turcica, which I mentioned earlier is where the pituitary gland sits. And the optic groove and the optic canal, can kind of see here. So this is the sella turcica here. And then the optic canals are here. That's where the optic nerves come. And then there's kind of an optic groove here where the optic nerves come and they cross right there. And because the pituitary sits in here, if your pituitary gets enlarged, it will actually press on the optic nerves. And one of the first symptoms is tunnel vision of a tumor on the pituitary gland. So make sure you can identify those optic canals as well, and the optic groove, as well as the sella turcica and the greater and the lesser wings. We get a better picture. There we go. Well, this is an anterior view. Okay, so this is looking at the sphenoid bone. If you looked right through the eye sockets and removed the bone around it, what would you see? I think the prominent things are these holes here. These are sinuses, the sphenoid sinuses, and we saw them on the sagittal view earlier. But here on the frontal view, you can see them. Of course, you can see the greater wing as well on the anterior view, and then you can see the lesser wing, which is these little guys here from the anterior view. So that's not really anything new that we haven't talked about. The thing that's new that you have to learn is this pterygoid process. And there's a lateral and a medial pterygoid plate. I don't care that you learn the idea of medial and lateral, as long as you understand this whole process here is called the pterygoid process. And this is going to be important later when we talk about muscle attachment. So I want you to learn that that part of the bone now, because it becomes important later with chewing. Okay, if we take the ethmoid bone out and just kind of look at it separately, this one is giving you the anterior view, and I think that's kind of the easiest one to look at. You can see there's what we call a perpendicular plate. That's what forms the back of the nasal septum to separate the right and left nares from each other. We have that cribiform plate that I mentioned. You're going to have to make sure you know that. So you need to know perpendicular plate, you need to know cribiform plate, and you're going to be able to identify the cribiform plate, because of these kind of air holes. And they're not really air holes. I mean, they are air holes, but they're the way that they function, or their purpose, is to allow the olfactory nerves to leave the nose and enter the skull. So in order to get, to enter the brain. So in order to get from the nose to the brain, you've got to have some holes in the bone. And it just so happens the way that the olfactory nerve, the smelling nerve, enters the brain is through multiple small nerves that exit through the top of the ethmoid bone through this cribiform plate. You'll also have to learn the crista galli. That's this kind of bony projection within the cribiform plate. On the posterior view, you can kind of see it sticks up a little bit like a horn. And I think really those are the only... Oh, the concha. You do have to learn the concha. So there's a superior and a middle nasal concha, or concha, some people say. And we're going to see these on the anterior view of the face really well. So we'll get a better look there, but these are going to be part of what cause air currents in the nose. So make sure you learn the superior and the middle nasal concha as well, and that they come off of the ethmoid bone. We'll see some better pictures of the concha when we look at the facial bones. All right, we also mentioned that there are, I mentioned this a while back in the lecture, that there were kind of 3 sections to the inside of the skull. We saw it on that lateral view, and we'll get a good picture here. And this is because the brain is kind of broken up into a few different sections. So the front part of the brain, or the frontal lobe, sits up here on the anterior cranial fossa. And the cerebellum, or the bottom part of the brain, excuse me, the occipital lobe and the cerebellum kind of sit down lower on the posterior fossa, and then everything else is kind of in the middle. This might make more sense here in a minute when we see the lateral view. Yeah. So here you would have, like, the front part of the brain is going to sit here, the frontal brain. And back here you're going to have the occipital lobe and the cerebellum sitting back here, and then the rest of the brain fills the middle cranial fossa. So there's 3 fossas, anterior, middle, and posterior. for different parts of the brain to kind of sit on, to rest on. Okay, next we can look at the facial bones. Of course, you've seen some of these pictures before, and you can see the bones of the cranium there, like we talked about before, but now we're going to focus a little bit lower on the facial bones. So I think the ones that are kind of most prominent and to me are just kind of easiest to learn is the mandible, which is, your jawbone. That's pretty big. And so that's one of them. This orange one, called the maxilla, which is kind of your upper jaw and part of your cheekbone. And you can see there's a right and left maxilla in orange. Then you've got your cheekbones, the rest of your cheekbones here, the part that attaches, as I mentioned before, to the temporal bone. We call that the zygomatic bone. And you see you have one on each side. Then there's the nasal bone. This is actually the right and left, you can see up here. And those are very small bones, out of which some cartilage comes to form most of your nose. So about 2/3 or 3/4 of your nose is composed of cartilage, but there is a little bit of bone up on the bridge of your nose. You can tell that that's much harder up on the bridge of your nose than it is out on the tip of your nose. So there is a right and left nasal bone. Let's see what else we can see on this picture. That may be... Oh, I did want to show you those concha that we had mentioned before. So remember, green is the ethmoid bone. So you can see a little bit here and a little bit here. And you can see that middle concha coming down and the superior concha and the perpendicular plate back in there. So you can see part of the ethmoid bone from looking head on at the face, anterior view, looking through the nose. If we look at the side view, you can see that zygomatic bone a lot easier. See how it forms kind of your lateral cheek, and you can see how it connects up with the zygomatic process of the temporal bone. You can see the maxilla here on the side, and see how it forms that kind of upper jaw area and your part of your cheek. You can see the nasal bone here, and then of course that mandible, which is really prominent as the jaw. You can also see on the mandible that when you get to where it articulates with the skull, it actually breaks into two parts, right? There's kind of a hole in between. And so we give each of those projections a different name, and we'll see that here in a minute. If you look inside the eye socket, of course you can see that green ethmoid bone, but we find a new bone of the face that we hadn't seen very well on the frontal view or the anterior view. You see this lacrimal bone, very small, that red bone. And lacrimal means tear. So there's a lacrimal gland, there's a lacrimal duct, there's the lacrimal bone. To cry or to tear is lacrimation. So lacrimal just refers to tear. That should hopefully help you remember that it's kind of the inside of the eye socket where most of your tears come from. If we look at that sagittal view of the skull and we come down and look at the facial bones, we will see a few prominent ones. You can see the ethmoid bone, of course, here, and that perpendicular plate of the ethmoid bone that really forms most of the septum in between the two sides of the nose. And that's part of the skull, like we mentioned before. But you can also see the nasal bone and how that comes out and forms the top part of your nose. You can still see the maxilla here in orange, the orange bone there. That's all maxilla. And we're going to find a couple of new bones that we didn't see in the previous pictures. You're going to find the vomer, which forms the rest of the nasal septum. So the superior part of the nasal septum is formed by the ethmoid bone, you can see in green. And then the inferior part of the nasal septum is formed by the vomer bone. And then you can see just a little bit of the palatine bone forming the back of the palate. That's where the name palatine bone comes from, is because it forms the posterior aspect of the bony palate. If you have a picture of the palate, if you would all just kind of take your tongue and touch the upper surface of your mouth, kind of the roof of your mouth, you'll feel a bone up there. You feel that it's hard up there. That's the palate. So that's this part. Most of that palate, 80% of that palate, is formed by the maxilla. You can see here in orange. But just the very back end of that is formed by the palatine bone. And we'll see another picture here in a minute. Okay, so we're going to add a few structures here. We see again, here's the maxilla in orange, and you can see how it forms most of the palate, except for that little bit posteriorly, and you can see the rest of the palatine bone kind of comes up here. We're going to add in here those nasal concha that we mentioned. You have the superior and the middle, and those come from the ethmoid bone. But then you have a inferior concha that is really comes off of the maxillary bone. We're going to see that sphenoid sinus again that we saw before. We're going to see that frontal sinus again that we saw before. You can see the internal acoustic meatus back on the temporal bone that we saw before. And notice that your teeth are really inserting into the maxillary bone, the maxilla there, on the upper side, and they're going to insert into the mandible on the lower teeth. All right, I've been mentioning sinuses. I just wanted to give you a view. You've all probably heard of sinusitis. That's when your sinuses get filled up with mucus, and then either a bacteria or a virus gets in there and kind of makes the tissue inflamed and tender, and your face begins to hurt. You might have a headache. You might have pain behind your eyes. You might have pain behind your cheeks. You might have pain down into your teeth as those sinuses get filled up with mucus and that pressure increases. There are 4 primary sinuses. The maxillary sinus, you can see here on the anterior view. So those are inside the maxillary bone. The sphenoidal sinuses you can see back here. Those are back in the sphenoid bone, which we've already mentioned. The ethmoid air cells, I mentioned how part of the ethmoid bone was pneumatized, and so they have sinuses there that can also fill up with mucus and get infected. And then the frontal sinuses there, just above your eyebrows, can also get infected and cause some pain and discomfort. This is just showing you if you kind of cut away and just looked at the different sinuses. You can see maxillary sinuses again, ethmoid sinuses again, back in there. This would be a coronal section through the back of somebody's face, and you can see where the eyes would be. You can see frontal sinuses here. You can see maxillary sinuses on either side. You can see the concha, the superior, the middle, and the inferior concha. You can see that vomer bone forms the inferior part of the nasal septum. You can see the perpendicular plate of the ethmoid bone forms the superior part of that nasal septum. And then you can see the hard palate here formed by the maxillary bone. This is the tongue. Okay, let's pull out sections of bone and look at particular parts of these bones that you're going to have to know. So not just, for example, knowing the maxilla as a facial bone, but there are some unique features of the maxilla that you'll have to learn as well. First, we'll look at the alveolar process. This is the kind of bony part right next to the teeth, and it's the part of the bone that the teeth insert into. So I want you to learn that one. I'll just mention this. I'll put a dotted line underneath. Anyone who's thinking about being a dentist, for example, the incisive canal that runs kind of on the lateral surface of the hard palate, that's where one of the main nerves are, and this is often where the dentist will put the needle to try to deaden that nerve. I do want you to learn the infraorbital foramen. So this is a hole that some nerves exit. They give you sensation and movement of the face. And it's a prominent feature of the maxilla, so you'll need to learn that. Then there's the frontal process. I'm not going to make you learn any of those, but there is an orbital surface here because the maxilla forms part of the eye socket. We'll see that better in another picture. So the main things really to take away from here would be that infraorbital foramen and that alveolar process. Those are the two things on this picture that you need to know. Oh, and the maxillary sinus, sorry. We've talked about that before, but you can see it now easily, a big hole in the maxilla. Okay, if we pull out the mandible and look at it separate, this would be the lower jaw. You also have an alveolar part where the teeth insert into the bone. I want you to learn this term mental protuberance. Mentum is the chin, so mental protuberance is what forms your chin. There is also these processes that we talked about. Remember the kind of posterior part of the mandible separates into two different sections. One is the coronoid process. That would be the more anterior portion. And one is the condylar process and the coronoid process. So make sure you learn condylar process and coronoid process, and make sure you can keep the two separate. One is posterior, that's the condylar process. One is anterior, that's the coronoid process. You also need to learn the angle, which is where it makes its bend. You can see the angle of the jaw there. And then this part of the bone is called the ramus. So make sure you learn the term ramus. You know where the angle is. You know where the mental protuberance is. Make sure you also learn the mental foramen. This is, again, where some nerves come out to give you sensation in the bottom part of the face and neck. And I think that's probably all you need on this picture. Okay, if we look at the eye socket itself, we'll find several bones that all come together to form the eye socket. Now, in anatomical terms, we don't call it the eye socket, we call it the orbit. So the orbit is kind of the eye socket that the globe of the eyeball sits inside of. And so that orbit is composed of many different bones. Let's look at all of them. So you do have the frontal bone, so that's one. You do have the sphenoid bone, so that's two. You have the ethmoid bone, that's three. So those are all bones from the skull that help form the posterior and the superior part of the orbit. You then have the lacrimal bone, that's, where are we now, 4. You have the maxilla, that's 5. You have the zygomatic bone, that's 6. You have the palatine bone, that's 7. And did we miss any? I feel like there's supposed to be 8. Let's see. 1, 2, 3, 4, 5, 6, 7. Okay. So all those bones come together to make the orbit. Here is that infraorbital foramen that we talked about in the maxilla, and you can see why it's called that. Infra means below, orbit means the eye, so it's just below the eye. It's a foramen, which is a hole just below the eye. I also want you to learn this structure here is the superior orbital fissure. That's where some of your muscles kind of attach or go through and attach to the eye. Superior orbital fissure, infraorbital foramen, and know which bones help form that orbit. Okay, nothing really new here, I think, on this picture. We've seen this one already. Just a quick mention here of the hyoid bone. It's kind of a free-floating bone. It doesn't articulate with any other bones. That's why we kind of say it's floating. It sits just below the chin and just above the Adam's apple. So if you feel your Adam's apple and you feel your chin and go in between, you might be able to just barely feel another bone in there. It's really important for swallowing and even helps a little bit in breathing because it's attached to the larynx or the voice box. It helps pull that voice box forward. It helps open up the trachea so that you can get more air, especially if there's inflammation there. So breaking that would affect swallowing but could also affect breathing. So it is an important bone even though it's tiny. You'll see in your bone boxes in lab we have examples of this, and there's just a few parts to learn. There's the greater horn and the lesser horn, and then the body, which is in between the horns. So pretty simple bone overall. This is just for you to kind of quiz yourself if you'd like to. Again, on the PowerPoint, this picture should be available to you. You could even print it off and practice kind of putting names to all of those arrows. Here's another example for you, and of course we'll go through these in lab together. If you have any questions, we can certainly go through them together. Here's the orbit. They're showing some of the sinuses as well as the nasal septum. Fontanelles I wanted to mention just briefly. Fontanelles are what in common language we would call soft spots on a baby. So when you exit the birth canal, your head has to fit through the birth canal. And that's a pretty small space. And so when we're fetuses and when we're first born, our cranial bones are not fully formed, and the sutures are not really tied together yet. And that's to help your head mold as you're trying to negotiate your head through the birth canal. It needs to be able to those bones need to be able to move in various directions to mold in order to fit through the birth canal. So it serves a good purpose. And then it takes about a year for those fontanelles to eventually close up. Now the posterior usually closes by 6 months, and the anterior can stay open up to 18 months. But in general, we just think about a year, those soft spots should be almost closed. There are two main soft spots or fontanelles, so make sure you learn the term fontanelle for soft spot. There's the anterior fontanelle. That's the one that's larger. That's the big soft spot on the top of the baby's head, but more anteriorly. And then on the back, there's also a posterior fontanelle where the lambdoid sutures will eventually be and where they meet the sagittal suture. There you can see the anterior fontanelle. There you can see the posterior fontanelle. You can see the posterior is typically much smaller than the anterior. Okay, vertebral column is kind of, we move down the axial skeleton. There are technically 5 parts to the vertebral column, although I'll tell you that most often we're talking about the top 3. We're always talking about the cervical spine, the thoracic spine, and the lumbar spine. There are 2 lower areas called the sacrum and the coccyx, or the sacral and the coccygeal vertebrae, and we'll talk about them. So in total there's 5, but the primary ones are the 3, the cervical, the thoracic, and the lumbar. So cervical is going to be top. Remember, cervicis meant neck, so this is going to be basically your neck. This is going to be your mid-back, and this is going to be your lower back. And the sacrum and the coccyx are kind of like your tailbone. So if we look at the general anatomy of a vertebrae, and you're going to have to learn this, I will put vertebrae out on the table, and I will have a sticker and say what part of the vertebrae is this. So you not only have to learn that there are 5 sections to the vertebrae, but you're going to have to be able to look at a sample of a vertebra and tell me the different parts. So the part that's easiest to identify, remember when you're learning anatomy, kind of pick what's easiest, what's most obvious, I think is this big part, is the vertebral body. So that's going to be the easiest thing to remember. Probably the next easiest is the big hole, and that's the vertebral foramen. So these shouldn't be difficult to memorize. They both have the word vertebral, which makes sense because they're vertebrae. The body is the main part of the bone, and the foramen is the hole, the big hole in the bone. So vertebral foramen and vertebral body should be really the first things that you learn. Now we can kind of disagree on what's the most, prominent part of the bone, but I think this spinous process is the next most prominent part of the bone. And that's actually the part of the bone that you can feel. If you will rub your thumb against your spine, and you'll kind of feel these kind of the tips of bones as you run down your spinal column or your vertebral column. Those are the spinous processes. So these are kind of the points that stick out posteriorly that you can actually feel on a person's back. So you'll have to learn that as well. And then I think the next easiest are these kind of lateral spiny processes. And because they look like they go across like this, right? They look like they go across like that. We call them transverse processes. So you've got one spinous process and two transverse processes for each of these vertebrae. Okay, then we have a couple other areas to look at. The superior articular process, this is going to be the part that forms a joint, articulates with the vertebrae above it. And then you see there's an inferior articular facet and articular process. So here's the inferior articular process, would be this bony part. The facet is going to be just the end. That's the facet. That's what forms the joint with the vertebra behind it. So one way to look at it is to say the inferior articular process of one vertebrae is going to articulate with the superior articular process of the vertebrae below it. Okay, then we've got one last part, is the part that connects the body to the articular processes and transverse processes, and we call that the pedicle. And that's important to learn because often that's the part that breaks on a vertebra, and so they'll talk about a fracture in the pedicle. So you'll want to know that particular name. We give a name to this whole area. We call it the vertebral arch because it kind of looks like an arch on either side. So the vertebral arch would be formed by the pedicle, the transverse process, and the articular processes would all form the vertebral arch. If you look at it from a lateral view, you can see the body is kind of prominent, as we mentioned. You can see that spinous process comes out posterior and is quite prominent. Now we're going to be able to see the articulating surfaces better. So there's a kind of an inferior articular process with its facet, which is basically the joint. And then there's a superior articular process, and on the inside you can't see would be the facet for that. And so this part of one is going to articulate with this part of the one above it. You can see there's a hole in here. That would be where the vertebral foramen is. And then you can see the pedicle is kind of this part of the bone that attaches the body to the back end of the vertebrae. And if you're not sure what you're looking at when we get in lab together, make sure you have me come over and help you see the different parts. Okay, this is just showing you how they fit together. So if we look at a posterior view, well, actually, let's stick over here. Let's come over here with the lateral view because I think it's easier to see the joints. So remember, this is the body here, and this is the pedicle here. And here you've got the superior articular process with its facet. And down here you've got the inferior process with its facet, right? And what you can see in the picture is that the inferior process of one is articulating with the superior process of another, right? So, and that's how the joints are formed in the between two vertebrae. Now, if we kind of cut through and did a sagittal section through, you would also see the discs, which we're going to add in between the vertebrae. And you see compact bone here, and you see spongy bone in here, right? And that's good because that helps keep the bones lighter so that we're not so heavy. Now, if we come over here and look at a posterior view, we can see those spinous processes easily. That's the part that you can actually feel. And we can see the facet joints. This is where the inferior of one connects with the superior of another. So we call those facet joints. And then, of course, you can still see the intervertebral discs in between. Here's a picture of an MRI showing you the vertebrae in the spine. So this would be posterior here, and this would be anterior here. Excuse me. And what you can see, what's most posterior, you can see the vertebrae. They look like rectangles. You see those? And the kind of thinner pieces in between, those would be the discs. And this is the bottom part of the brain, and then the medulla going into the spinal column. So you can see how the spinal column is protected posteriorly really by the vertebral bodies, and anteriorly there's of course some bone on the other side of the foramen, but there's also tons of muscle and tissue there that can protect the spinal column. If we look at the vertebrae separately, I just want to go through a few unique features of the cervical vertebrae because they are a bit different from the other vertebrae in a few ways. One is that they have a smaller vertebral body. So we were looking at thoracic and lumbar vertebrae previously, and you saw that the vertebral body was really big, really prominent. The vertebral foramen is quite large. It's basically the same size as the vertebral body. And that's because you've got more nerves coming directly from the brain. Remember the cervical vertebrae, there's 7 of them. But remember the cervical vertebrae are at the top, right? They're at the neck. So they're the part that connect the vertebral column to the skull. So that's the part that the spinal cord is going to exit the brain and enter the back, so to speak. And so that's where all of the nerves are. And as the spinal cord goes from top of your neck down to your lower back, it's giving off nerves all throughout the body. So by the time it gets to your lower spine, it's actually much smaller than it is when it leaves the brain. So you need a much larger vertebral foramen in cervical vertebrae because the spinal cord is larger at the top because it has more nerve fibers in it. There are also large, transverse foramen. So remember, foramen just means whole, right? And we have a vertebral foramen, and we have transverse foramen. And these are large as well because, again, you're giving off large amounts of nerves are coming off the spinal cord and going from the neck and shoulder into the arms to control your upper limbs, to control neck movements, to even to control breathing and other things. So you need larger foramen for those nerves to come out because there's more nerves there to come out. Interestingly, you also have a tip. The spinous process that we talked about before in cervical vertebrae is bifid, meaning it has 2 tips to it instead of just 1. So that's interesting. And then there are 2 special vertebrae that articulate with the skull, and so they actually get separate names. So C1, which is the first cervical vertebrae, and C2, which is the second cervical vertebrae, have their own names. And we don't give names to any of the other vertebrae, just these 2 get their own names. So we call C1 Atlas. If you remember from Greek mythology, Atlas was the god who's holding the world up on his shoulders. And so we call the first cervical vertebrae Atlas because it's holding the skull up because it articulates with the skull. So that's where the word Atlas comes from. Axis you can kind of think of as of movement, swiveling on an axis. So C2 is called the axis bone, and it's because it's what allows your head to swivel back and forth. And we'll see here its unique feature in it. Okay, so the atlas has a couple of unique features. There is no vertebral body. That sounds like a good test question. Which vertebrae has no vertebral body? That would be C1 or atlas. And that's because it's got to make room for a huge vertebral foramen because the medulla oblongata and the spinal cord are connecting there, and it's a very large spinal cord that's exiting the brain. And so you've got to have a very large foramen. It also has huge superior facets because it has to articulate not with another vertebra, but it has to articulate with the occiput, the occipital bone. Remember those occipital condyles? Those occipital condyles are going to articulate with the superior articular facet of the atlas. So those are kind of the main things to remember there. Large superior articular facets and no vertebral body. The articulation between the skull and C1 or atlas is what allows us to bend our head up and down, like the nodding of yes or no. I'm sorry, not no, the nodding of yes, nodding up and down. That's from this articulation between those facets and the occipital bone. Axis, sorry, this should say axis, not atlas, has a very unique structure to it as well. It has something called a dens that sits on top of a very small vertebral body. And it's a projection that kind of juts out superiorly from the bone, and it articulates with the posterior arch of the atlas bone. And so it allows your head to swivel back and forth. We'll see here in a picture in a minute. If we look on the undersurface, the inferior view, you'll see a very small vertebral body, and you'll see that bifid spinous process there as well. But the main thing to learn on the axis is that dens. So small vertebral body and that dens. And that helps our head to swivel or to basically shake our head no. So here's how it works. This is C2 and this is C1. And you can see the large articular facets here that articulate with the occipital condyles of the skull and allow us to nod our head yes and no. But it's the dens, which comes up superiorly from the axis bone, that allows our head to kind of swivel back and forth like no, because you can see how this ligament here kind of attaches to the dens, and you would be able to swivel then one way or another with that C2 axis bone. Okay, as we go down, the only thing I wanted to mention is that the vertebral body gets bigger. So thoracic vertebrae, the body's bigger than cervical, but look, when we get to lumbar vertebrae way down in the lower back, it's even bigger. Otherwise, the rest of the structures are fairly similar. You have a spinous process, you have two transverse processes. They're kind of similar. The articular processes are a little bit more pronounced here in the lumbar vertebrae. Okay, if we continue on down, so we did cervical, there's 7 vertebrae, then we did thoracic, there's 12 vertebrae, then we do lumbar, there's 5 vertebrae, and then attached to L5, the 5th one, would be the sacrum, and attached to the sacrum would be the coccyx, or what we typically call the tailbone. So the tailbone is called the coccyx. And the sacrum has a few unique structures. Really, the only thing I want to mention, I think, from this picture are these foramen, which when we have multiple foramen, we call them foramina. So the sacral foramina would be the holes that a lot of the nerves that are going to go down into the leg and control sensation and movement of the leg, they're going to exit through these sacral foramina. And that's why you have those big holes there. Just a brief word on the thoracic cage. Obviously, it's protection for the very delicate organs. Your lung is very delicate tissue, very soft, squishy tissue. Of course, your heart is very important, needs to be protected. And so it's largely there for protection. It does also, however, help in breathing, and we'll talk about that in physiology. Expansion of the thoracic cage helps air move in to the lungs. It also attaches posterior to the vertebral column. So if we break up the thorax, we can look at the sternum, which is the breastbone you see here. Then obviously we've got ribs on both sides. So the sternum is broken up into three sections. The manubrium, which is kind of the fat part on the top, then the body, which makes up most of the sternum or breastbone, and then this kind of pointy part that just projects out from the body called the xiphoid process. And you'll need to learn all three parts of that, the sternum. The ribs, there are 7 true ribs. That means that they attach both anteriorly and posteriorly to the spinal column posteriorly and to the sternum anteriorly. 8 to 10 are called false ribs. And then you have a couple of floating ribs in the back, 11 and 12, that really are not attached all the way around. They don't attach anteriorly and posteriorly. So, for example, here you can see 12 is just kind of floating. You can see 11 is just kind of floating. So they're not really attached. So the ones that attach, that do not attach directly to the vertebrae, we're going to call false ribs. The ones that attach directly to the vertebrae, we will call true ribs. So let's see if we can see in the picture here. Yeah, like these ones you can see that they're clearly attaching to the vertebrae, and these ones you see how they're attaching kind of in between two vertebrae, so we call those the false ribs. If you took a rib out, you could look at some unique features of the rib. You should know the body of the rib. You should know the angle. You need to learn this costal groove because that's where the nerve, artery, and vein runs through, and that's really important if you ever have to do any procedures on the chest. You always go over the top of the rib because the bottom of the rib has that costal groove, and that's where the nerve, artery, and vein are, and you don't want to accidentally puncture the nerve, artery, or vein. So you always go over the top of the rib. And then there's a head, a neck, and a tubercle. So make sure you learn those parts as well. So one end is articulating with the the spine on the back, and the other is articulating with costal cartilage on the sternal side. Okay, we'll take a look at these together in class during lab time, and if there's anything you didn't understand, make sure you grab me during lab time, and I'll be happy to help you.